Movements of the joints. Flexion. Movement that decreases the joint angle. Extension. Movement that increases the joint angle. Hyperextension. Extension past the anatomical position. Lateral flexion. When the vertebral column bends to the side. Plantar flexion. Extends the ankle joint that elevates the heel. Dorsiflexion. Flexion of the ankle joint and elevation of the sole. Abduction. Movement away from the longitudinal axis of the body in the frontal plane. Adduction. Movement towards the longitudinal axis of the body in the frontal plane. Circumduction. Circular motion involving flexion, extension, abduction, and adduction. Rotation. Rotational movements of the trunk. Right rotation. Turning of the head to the right when in anatomical position. Left rotation. Turning of the head to the left when in anatomical position. Pronation. The anterior surface of a limb turns towards the long axis of the trunk. Supination. Anterior surface of a limb is turned away from the long axis of the trunk. Opposition. Movement of the thumb towards the palm or pads of the other fingers. Inversion. Twisting motion of the foot that turns the sole inward, elevating the medial edge of the sole. Eversion. Twisting motion of the foot that turns the sole outward, elevating the lateral edge of the sole. Elevation. Movement in a superior direction. Depression. Movement in an inferior direction. Protraction. Moving a part of the body anteriorly in the horizontal plane. Retraction. Moving a part of the body posteriorly in the horizontal plane.